Hi everyone, my name is Kaylee Marston. I'm a speech language pathologist at Levine Cancer Institute. Thanks for joining me for this part one of a multi-part series where we're going to be talking about cognitive and communication changes in cancer. Today's focus is going to be talking about central nervous system related cancers and treatments and the cognitive and communication symptoms that we see as a result. So first, when we think about what the central nervous system includes, that's the brain and spinal cord. And so cancers of the central nervous system would be things like primary brain tumors, such as a glioblastoma, although there's many other different types, as well as brain lesions as a result of metastatic disease, or also known as when cancer travels from one part of the body and metastasizes to another, in this case, the brain. For instance, if someone is diagnosed with breast cancer or skin cancer and unfortunately experiences metastatic brain lesions as a result of the cancer metastasizing there. So the symptoms of primary brain tumors and lesions will really depend on the size or the amount of lesions or tumors and the location in the brain. We know that our brain is kind of divided up into different parts, and that those parts are kind of responsible for different cognitive processes, although they all talk to each other and work together for us to function. An example would be if we have a brain tumor on the left side of the brain, sometimes we will see difficulty with language. Or if there's maybe a tumor towards the back of the brain, we might see deficits in vision. And those are just some examples. A lot of times we have found that the symptoms have been developing over time, and over time can even look like decades in some cases of brain tumors. Of course, if someone has surgery, radiation, chemotherapy, or is on different types of medications, these types of treatments will, of course, also affect someone's cognitive and communication functioning over time. And how they look sort of in the beginning or prior to radiation and chemotherapy may be different than how they look after, or even a year out or 2 years out, etc. And so we're constantly kind of reassessing for that reason. So, some of the symptoms or kind of impact that I see as a result in my patients here at the Cognitive Clinic at Levine Cancer Institute is listed below. I'm going to go over a few of these. Keep in mind that patients coming to me, of course, are having difficulties with some cognitive and or communication functioning. Otherwise, they wouldn't be referred to me. I would say aphasia is a big one. Aphasia is the name of a disorder that involves difficulty with language. Aphasia can result not only from a brain tumor, but also from things such as stroke, when parts of the brain that are responsible for language are damaged. And so this can look like difficulty with verbal expression or putting words together. It can also look like having difficulty with comprehending or understanding language, reading and writing deficits, and it's really a spectrum. Sometimes you can have all of those difficulties, or you can mostly have kind of deficits in one of those areas. So again, it really depends on size, location of tumor or lesions. I work a lot with patients too on attention. So distractibility or having difficulty concentrating is very common. Patients unfortunately may experience personality changes that can look like being really impulsive, being really defensive, having trouble inhibiting, or having a lack of awareness. Um, we also deal a lot with memory deficits. And again, like aphasia, memory deficits can vastly range. Some people may have more trouble with remembering events that just happened, or even that happened a few moments ago, in more severe cases of amnesia. Whereas some patients can even have some deficits with long-term memory recall, again, usually in a more severe case. This looks different than things like Alzheimer's, despite that it can seem like there are some similarities. So again, we're really kind of assessing for those in different ways, which we'll go over in another video. But overall, having one or multiple of these symptoms often can affect someone's independence. It can affect their safety or like being left alone. It can impact really the quality of their life, kind of their social or emotional functioning, being involved in their life, which we call life participation. It can affect caregivers and those around them because maybe they're having to provide them more care if they're having difficulty with some of the things that I just talked about. And so, again, that's why we are here to try to help. So hopefully this was a good overview of central nervous system related cancers and the cognitive and communication changes that we see. In a next video, I'll go over some other reasons someone might experience that, such as chemo brain. So if you have questions or comments, please leave them below, and please like and subscribe to our videos. Thank you.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.